There are things called silent heart attacks, and what that means to us is someone who comes in for either an angiogram or comes in for a nuclear stress test, and we do those tests and we see that in fact they've had a heart attack or have blockage. And it's not uncommon for us to see that. It usually occurs either because people have no symptoms whatsoever, but more commonly their symptoms are so vague and they just didn't realize they were having a heart attack. Sometimes they think they had the flu for a couple of days. They feel a little out of the weather, a little short of breath, some fatigue. They sit through it, goes away in 3 days. Well, guess what? They've just survived their heart attack in their living room. We prefer them to be in the hospital, but they didn't know. They had no idea. And yet we'll do a test 2 years later for some other reason, and in fact we'll see evidence of that. So it definitely does happen. I guess the answer is really be sensitive to yourself. Be sensitive to your bodies. If something doesn't feel right to you, go see somebody. Even if it's going to see your primary care provider who can do an EKG in the office, can get a good history. The reality is that you don't want to ignore these things, especially if they're not getting better soon. And I will say, shortness of breath, really being short of breath, you ought to go see your provider. Okay? It's something that's not normal. I mean, even if it's not a heart attack, you don't know if you've developed pneumonia, and that needs to be treated. So take these symptoms seriously. Some of it I sometimes think is, in some ways, common sense, although it's not really common sense. You just have to be in tune to yourself. And even under the best of circumstances, there are still going to be people who have these silent heart attacks with really minimal symptoms. The people at the most risk for having these atypical symptoms, I've already mentioned female patients, elderly patients, and patients with diabetes. Often with diabetes, you don't have the classic angina, crushing chest pain that we usually describe with this. So it can happen, we see it, just be sensitive to your bodies.